Order, order. I will call Kate Osmore to move the motion, and I will then call the Minister to respond. I remind other members, if they're here, that they may only speak with prior permission of the member in charge of the debate and the Minister. There will not be an opportunity for the member in charge to wind up, as is the convention for 30-minute debates. Order, order. Kate Osmore to move the motion.
I beg to move that this House has considered the experience of cancer patients with accident and emergency services at North Middlesex Hospital. It is a pleasure to serve under your chairship, Mr Morrison. I thank you and the House for granting me the opportunity to speak about the urgent care pathway for cancer patients at North Middlesex University Hospital, and to discuss the potential for dedicated funding for an oncology assessment unit. In Edmonton and Winchmore Hill, as with many constituencies across the country, too many people with cancer are being let down. In the UK, cancer mortality rates are significantly higher than in comparable countries, and the survival rate is lower. I am glad that the government has recognised this issue and is making steps to address it, most significantly through the National Cancer Plan. I welcome the plan's ambition to diagnose more cancers early, to ensure treatment starts more quickly, and to improve survival. Let's give way.
And the Honourable Lady for bringing this forward, and she's right to illustrate the issue with her own hospital and how important it is, and it's replicated wherever it may be in the United Kingdom. And indeed back home, it seems that people are waiting 12 hours for admission or discharge. Attending A&Es are should be treated within 4 hours. It's not happening. Does the Honourable Lady agree that strengthening community-based cancer services is essentially to protect patients, ease pressure on emergency departments, and ensure that people with cancer get the right care in the right place at the right time?
I thank the honourable member for his intervention, and later on in my speech I will go on to the work that the community is doing, and I thank him for his intervention. Faster diagnosis and quicker treatment are, of course, vital to improving outcomes for cancer patients. However, Chair, I am concerned that less emphasis is being placed by the government on the other critical aspects of care which cancer patients receive. The case of North Middlesex Hospital in the constituency where I am very proud to represent, of Edmonton and Winchmore Hill, is evidence of this. On one hand, since 2023, North Middlesex Hospital has received 2 new radiotherapy machines, which should help to ensure that cancer patients receive treatment more quickly and limit the number of hospital visits that they need to make. But on the other hand, North Middlesex Hospital is under-resourced in other important areas, and this is having a negative impact on the experience of patients. In particular, I have concerns about the experience of cancer patients in the accident and emergency department. From talking to my constituents and their families, I know that oncology patients admitted to the hospital are often assessed in the emergency department. That does not have the physical space or isolation capacity required to safely manage immunocompromised individuals. Despite an acute oncology service which works extremely hard to prioritise these patients, due to the high patient volumes and infection control pressures, the North Middlesex Hospital emergency department often struggles to provide appropriate private triage areas or to guarantee a rapid review for vulnerable cancer patients. Over recent years, this has caused a number of my constituents to be put in an environment unsuitable for their condition and has caused a great deal of upset and discomfort. I have been in correspondence with one of my constituents, Mrs Mary Thorne, regarding the experience of her late husband, Mr Jack Thorne, at North Middlesex Hospital. Ms Thorne has given me permission to discuss the experience of her late husband at the hospital. Mr Thorne was diagnosed with cancer in July 2022, and in January 2023 he began chemotherapy treatment. Following the conclusion of this first type of chemotherapy treatment, Mr Thorne was told multiple times that he needed to be admitted back into hospital. However, upon arriving at hospital, rather than being admitted straight into the cancer ward, he was made to sit in the A&E waiting room in order to be triaged. On one occasion, he was made to wait for 15 hours. But due to the immunosuppressive treatment many cancer patients undergo, they are at a heightened risk of infection, meaning that staying in A&E wards for extended periods of time risk worsening their condition. Since my correspondence with Mrs. Vaughan, I have heard from several other constituents who have suffered similar ordeals. One of my constituents, who has now sadly passed away, went to the North Middlesex Emergency Department following a concerning reaction to the immunotherapy treatment she was receiving for her cancer. She arrived at the hospital on a Saturday and was not moved into a side room until the Monday, meaning she was forced to sleep in a chair for 2 days while being very unwell. She could not shower during this time, had no privacy, and was unable to return home to collect any belongings or change clothing. Since hearing of Mr. Vaughan's experience, I have closely engaged with the North Middlesex Hospital and the Royal Free Foundation Trust, which now manages the hospital. The Royal Free Trust has been taking steps to improve the experience of oncology patients in North Middlesex Hospital through efforts to reduce waiting times and speed up the pathway for oncology patients. This has included the creation of the same-day emergency care hub and the emergency ambulatory care unit, which provides a safer and more appropriate environment for patients away from the emergency department. But despite these measures, North Middlesex Hospital has not been provided with the necessary resources for the triage of patients requiring isolation. The Trust proposes initiative to establish an oncology assessment unit for patients requiring minimal intervention to bypass the emergency department. But this has been prevented from progressing further after some promising initial steps. This was due to 1, no available funds in existing budgets, and 2, the lack of external funding to hire the additional specialist staff required for establishing this oncology assessment unit. This highlights an urgent need for targeted investment. Without dedicated support, the Trust will not be able to guarantee this safer, specialist-led pathway for cancer patients, which clinicians have repeatedly recommended. The experiences of Mr. Vaughan and my other constituents demonstrates the human impact of this gap in provision, and the response of the Trust itself makes clear that local efforts alone cannot solve this issue. So if the government is serious about putting cancer patients front and centre, as the Secretary of State for Health and Social Care has previously stated, then it must do more to support stretched and under-resourced hospitals such as the North Middlesex, as well as its dedicated and hard-working staff. Not only to protect the dignity and well-being of cancer patients, but also to improve outcomes and survival rates. So as I draw my comments to a close, I have 3 requests that I would like to ask the Minister to consider in her winding up. Firstly, whether the department will consider taking steps to ensure that North Middlesex Hospital is granted the funding it needs to establish an oncology assessment unit so that patients experiencing treatment-related complications can be assessed properly in an appropriate environment, avoiding the risks associated with overcrowded emergency departments. Secondly, will the Minister consider carrying out a wider assessment of the safety and suitability of the settings in which immunocompromised oncology patients are placed when they are admitted to hospital across the country, and how this may affect outcomes for cancer patients? And lastly, how will the proposals in the 10-year health plan for England to shift from hospital to community care affect the experience of those suffering from cancer, to prevent them from having to attend A&E in the first place? And finally, I would like to pay tribute to Mrs. Vaughan for her tireless advocacy on this matter, both with myself and my office, and the North Middlesex Hospital and the wider Royal Free London Foundation Trust to push for improvements to oncology care following the death of her late husband, Mr. Jack Vaughan. Her constant advocacy in the face of such devastating loss is truly commendable. I thank you.
Minister.
Thank you, Dr. Morrison. It's a pleasure to serve under your chairmanship this morning. And can I thank my friend, the Honourable Member for Edmonton Winchmore Hill, for tabling this debate. And can I echo her comments in winding up support to Sean and in light of her husband Jack's experience. And I know she's worked diligently on behalf of her constituent. We all know that constituents shouldn't have to do this advocacy really when they are suffering from such trauma and such experience, but their experience are always valuable, and I know as constituency MPs herself, as I do, are grateful to people for sharing that, and she's done an excellent job on behalf of her constituent this morning, because we are clear that every patient should be treated with dignity and respect, and we know that for far too long NHS performance and practices have not been meeting the high standards that patients should expect, and that is why we are taking action to improve cancer pathways and urgent emergency care to build an NHS fit for the future, particularly with regard to the treatment of cancer patients in A&E. Far too many cancer patients and their families have been failed by the NHS, with their care lacking that empathy and dignity. And it is not right that patients facing distressing situations waiting for care in A&E, particularly those with a cancer diagnosis. So through our recently published National Cancer Plan that she alluded to, we do commit to addressing those poor experiences, driving earlier diagnosis and support general practitioners to spot cancer earlier, for example through Jessie's Rule, and reducing inappropriate diagnosis in A&E. Jessie's Rule is a patient safety principle requiring GPs to reflect, review and rethink a patient's diagnosis after 3 unresolved presentations to reduce missed and delayed cancer diagnosis. But Dr. Morrison, my honourable friend, like me, entered Parliament at the same time, and she had her experience in primary care, as I did as a commissioner, and I know that she will be as shocked as I am that in the year 2026 and in recent years, cancer patients should not be going through A&E like this, who are known with a condition. That's something we've been working on for a very long time. This plan will reduce the need for people undergoing cancer treatment having to attend A&E. For example, through rapid access to a booked appointment in same-day emergency care, as we already see, as she has alluded to, in other local trusts, for example in her area like the Whittington. This should be standard, and in many places is. We recognise that some cancer patients will have more extensive needs, and for these patients we need to deliver an enhanced level of care during and after treatment, known as supportive oncology. This will include support for severe and sometimes sudden symptoms, meaning people can get rapid access to the right care in their home or community. This will be key to getting these patients the support they need, reducing the need to ever attend A&E in this way. It is vital that we deliver compassionate cancer care in the best setting for each patient, and our National Cancer Plan will redesign cancer services around people's lives, not just around hospitals, recognising that more people are living longer with and beyond cancer and need ongoing and coordinated support. That support will increasingly be delivered through neighbourhood services and accessible digitally through the NHS app, and we will ensure that patients have a named neighbourhood lead to help coordinate their care locally. Working alongside hospital specialists to provide continuity, reduce fragmentation and make it easier for people to navigate services in her constituency and across the country. We will deliver greater use of virtual monitoring and growing opportunities for treatment and follow-up in community settings where safe and appropriate. And this will help ensure patients get that high-quality support early, reducing the crisis situations, such as she's alluded to, that currently drive those unacceptable and unnecessary A&E visits. Where patients do need to attend A&E, we are committed to improving those standards and returning the waiting time set out in the NHS Constitution. We have expert improvement teams providing tailored support to challenge trusts like the North Middlesex, and they have shown progress, again, as she has highlighted today, and I pay tribute to the work of leaders locally in improving this situation. They've made progress since last year, and in addition, the NHS, the team in London, have recently agreed to a pilot for the Oncology Assessment Unit to proactively support cancer patients away from ED as she alerts. And if she needs more detail on the final confirmation of that, I will make sure that she gets that in writing after that debate, as she has relayed, because we do think that is an appropriate way to proceed. Nationally, we recently published guidance on the Model Emergency Department, setting out the core principles and pathways for high-performing emergency departments. Our urgent and emergency care plan for 25-26 set out a clear path to strengthen urgent care outside hospital, and we're using data from shared patient care records and digital tools to support better triage, join up services and anticipate pressures before they arise. And this is backed by £2 billion of investment in NHS digital infrastructure. We're also investing £250 million to strengthen same-day emergency care and urgent treatment provision, centre provision, helping systems avoid unnecessary admissions for patients and supporting same-day diagnosis, treatment and discharge of patients. And this plan is working. A&E performance is improving, and there are more people receiving their cancer diagnosis within a month. We don't underestimate how much more there is to do, and how difficult it is for many patients, both from the North Mid, as she has alluded to this morning, and in other places. But we do want to take the best to the rest. We know there is more to do, but the investment and the modernisation along those clear pathways are starting to make a difference, and the NHS is showing clear signs of recovery. So, Dr Murison, the NHS is under pressure. This government is taking the decisive action through our urgent care emergency plan and the National Cancer Plan and our longer-term reforms. We are putting the service back on its feet and ensuring that patients receive the high-quality, timely care that they deserve. And I welcome the honourable members this morning raising this issue on behalf of her constituents and many other honourable members who discussed the issues with me. Very happy to continue working with her and local NHS leaders on how we can further strengthen the urgent emergency care services and the delivery of that cancer plan to reduce the disparities and support patients to receive the right care in the right place. Thank you.
The question is that this House has considered the experience of cancer patients with accidents and emergency services at the North Middlesex Hospital. As many as are of that opinion say aye. The contrary no. I think the ayes have it. The ayes have it. Order, order. The sitting is suspended until 2:30 p.m.